Hey, you all guys. Thank you for joining me. I'm Dr. Aguilar from Texas Integrative Medicine and Cardiology. And as we had posted, we're here to talk about ketogenic diet. Ketogenic diet is in sort of like trendy. There's a lot of people talking about it. There's a lot of people that do not know what it is, how it's done, and there's other people that is doing it, but not doing it in a correct way, which could be harmful if it's not done right. So the first question is, so what is ketogenic diet? And ketogenic diet is a way of eating that is going to be mostly based on fatty sources, meaning fat. Forget about this fat being the devil that we were led to believe it is, all the way from back to these 80s and so forth. Um, it is not. And also, not fat, all fat is not created equal. There's some fat that are very benign fats, and there are other fats that are not as good as we think they are, but they're not as bad as we thought they were. So we'll talk about that. Most of the times that we eat in our diet, we eat a lot of sugar, sugar related foods. For example, oatmeal, grains, cereal, yogurt. All of those things are, in general, just sugar, plain sugar. Other things like flour, mainly bread. Even if it's like a whole wheat bread, is bread, brown bread, black bread. Bread is bread. Even the Ezekiel bread that is made of grains is bread. So all of those things is sugar. And to give you an idea how prevalent sugar is in our diet, if I were to take sugar off the shelves of any supermarket in the United States, I'll probably be emptying around 80 to 85% of all the shelves. So we read labels and it says no added sugar, just because it's loaded with sugar anyway, so you're eating sugar regardless. Now, cells like glucose, which is sugar, because they make energy out of it. And that's the main source of the energy for any cells. However, our human cells can also eat ketone bodies. That's where the name ketogenic comes, because if you eat mostly fat, good fats, healthy fats, now we're going to be generating ketone bodies, which can be food for our cells. It takes a little while, maybe a week, sometimes 4 weeks, depending on the diet, to start generating that. So if we feed our bodies with this kind of diet that I'm going to explain, we're going to be feeding our cells mostly with ketone bodies instead of sugar, which in many ways is healthier, but ketogenic diet is not for everybody, and we can say at the end who is not supposed to go in a ketogenic diet. So in any case, our diet right now is composed of around 75% of sugar or sugar related like carbohydrates, around 20% of proteins, and about 5, maybe 10, maybe 15% of fat. That's the way we've been told to eat. And if you look at the USDA pyramid, that's the way they tell us to keep eating. Ketogenic diet is pretty much turning the pyramid upside down, meaning about 75% or so is going to be fat, around 20, maybe 15% is going to be protein, and only about 5, maybe 10% is going to be carbohydrates, meaning sugar. And that is very doable. It is actually very tasty, and it has a lot of benefits that we'll talk about. Now, obesity is been climbing rather fast since the 80s. And that's because in the 70s, the way we eat included a lot of sugar. And everybody thinks that diabetes, pre-diabetes, is caused by obesity. And I'm going to tell you this, it's actually the opposite. Too much sugar in our diet is now the way that we start not responding very well to a hormone that I'm going to talk about. And this way we're going to get fat, overweight, fat, and obese. And now around 75% of the population in the United States are either overweight or obese. So in any way, what happens is this. When we eat too much sugar, we are asking our body, mainly the pancreas, to produce an hormone that we call insulin. Think about insulin as a traffic controller at an airport base. Imagine this person, the insulin, directing the flights coming in and out. One plane here, one plane there, one plane here, one plane there. However, insulin cannot control what we eat. And imagine that all of a sudden to this airport, only jumbo jets are coming in, the Boeing 747s. And there's only 2 gates that will take those guys, and there's like 20 other gates that will take smaller airplanes. Well, if we have 2, 3, 4, 5, maybe 10 jumbo jets coming in, there's going to be congesting to those gates, 2 of those, whereas the others are going to be empty. So in another way, if we have plenty of different sizes of gates, then we can accommodate different planes coming in and out. So what we eat determines what's going to happen with the food. If we take too much sugar, sugar is going to be stored. Insulin, even though it's our friend because it helps us getting glucose into the cells, it also is our enemy because it creates fat, and this fat goes into the belly. So whenever you see someone with a big belly, their intake of sugar is quite likely very high, and they're developing something that we call metabolic syndrome, which is pre-diabetes. 70% of the people in the United States are metabolic syndrome or pre-diabetics. That's a lot. Now, can ketogenic diet reverse this? You bet. You bet. It's very doable. It's very safe. And I know people have done this. They've been doing this diet for at least 5, 10 years of their lives without any issues whatsoever. Ketogenic diet is not new. Ketogenic diet is not exactly Atkins diet, but it's not new. It's been around for a long, long time. If you guys are cyclists out there, Chris Froome and Romain Bardet from the Tour de France, they've been cyclists that are world, known. However, they were like mediocre for many years. When they went into ketogenic diet, Chris Froome now has won 4 Tour de France, and Romain Bardet was in the podium a couple of times. So ketogenic diet can be done for athletes, and it's very doable, and it's very good. Now, ketogenic diet, since it changes the way our cells are feeding themselves, it changes some of the way they work for a better or benign way. If people out there with epilepsy, people with seizures, people with diabetes, people with high blood pressure, those are perfect candidates for ketogenic diet. People out there with overweight, with obesity, perfect candidates for ketogenic diet. People out there with kidney problems, advanced kidney, liver, pancreas issues, we have to be careful, and we have to be, to analyze whether they are candidates or not. Chances are they may not, but that needs to be checked. So my message is this. If you're thinking about a ketogenic diet, number one thing is this. You need to check baseline labs. Simple, plain, simple. You can do with your primary care physician. Making sure that you could be a candidate for ketogenic diet. And if you decide to go further and do it, you need to make sure that you do it properly. You do it with good judgment and with good guidance and training. Sometimes not eating correctly in a ketogenic diet can be sort of like the opposite. Instead of being good, you may not get the benefits that you're looking for. Now, I believe that in medicine, along the way, we've been treating the consequences of what's happening. In other words, we see a lot of people with diabetes, obesity, high blood pressure, and you name it. All of these significant diseases that are all over the place. And I believe that we've been treating them just looking at the consequences. Let me give you an example. Imagine that we have a leak in the roof right now, and it rained yesterday, so we have a leak. So I'm going to put a bucket to make sure that we collect the water. It's not spilling over the floor. It's a very, rudimentary and very temporal way of taking care of it. We're not taking care of it really. However, that's what we do with diabetes nowadays. We usually use medications. And after 15 years of being an attending in medicine, I've never seen a patient cured from diabetes from taking 1, 2, 3, 4 medications, and even worse so when they're going to insulin. So diabetes is not cured with medications, I can tell you that. No trial has shown to be cured. However, when we use medications, we're pretty much putting a bucket in there, just collecting the water, making sure that we don't have a spill. Uh, if somebody gets creative, let's call it a company, now they're going to start creating beautiful buckets. Maybe buckets that are long enough that extend all the way to the roof to get the water in, and then maybe another little line outside to put it out there to the patio or the backyard. Well, that's a creative way to take care of the water, but still the problem is in the roof, and that's diabetes. The problem is in the insulin, in the cells, in the way we're feeding ourselves. If we want to take care of problems, we need to go to the roof and fix the problem so we don't have another leak. And that's what we do at Texas Integrative Medicine and Cardiology. We take care of the source of the problem. And ketogenic diet is helpful in this way. Yes, it is. Ketogenic diet is a way to treat diabetes, perhaps not for everybody, but that determines to be seen depending on the characteristics and the labs of the patient. And at this point, we welcome your questions. I see a bunch of people. Hi, Gabi. Mayram, hey, nice to see you around. Berito Lopez, nice to see you. Feel free to send your questions all around as people are coming in. Now, over there, around a period of 14 years in the city of El Paso, I took care of heart surgeries or heart operations or heart procedures almost on a daily basis. I operated hearts right and left. Eventually, I got into operating leg arteries, kidney arteries, arm arteries, and pretty much wherever I could get a catheter in and a wire, I would get myself to open a vessel that has been obstructed. And for many, many years, I did it with compassion. It was my passion to open vessels. But about 5 years ago, I started looking into, am I really doing something for my patients, just opening a vessel? And sometimes you get judgmental and seeing an obese person and say, well, you are obese because you're not doing things right, you're eating too much. And that's not true. Obese people, overweight people, it's a consequence, they're a victims of what we hear out there, what we do not know, and the way we eat and the way we just, live differently according to what we see everywhere. TV, billboards, trends, this and that. But mainly, we have been victims of the big pharma, just using more medications every day. That's pretty good for the shareholders. However, it's not really doing much for our health. Likewise, the food industry, they're doing great. No company there is suffering. They're just giving us very rich, very tasty, and very accessible food at a very good price that we just love to eat. So you need to educate yourself. You need to know what they are exactly. And I see a lot of more people. Charrita Vicky Gonzalez, how you doing? Lily, Lina Mingura, nice to see you. Now, there's a question in here by Liana. What food should I start the diet with? Well, we're talking about the ketogenic diet, and I can give you examples, but I will never be able to cover the whole spectrum of the food that we're talking about. But in general, things like good fats like avocado, some oils like extra virgin olive oil, coconut flour, coconut oil, avocado oil, even butter is actually quite okay depending on the quantity. So more than that, we probably want to make sure that someone is a good candidate for that. Do little exams which your insurance will cover, and if it doesn't cover them or you don't have insurance, that's a way to get around there with a very cheap testing anyway. You don't need to spend a lot of money. And then going over the diet, giving you exact ideas what to avoid mainly and what you should eat and what you can eat plenty of it. For the most part, sugars are going to be out. However, there's multiple cakes, pancakes, muffins that we can prepare in a very healthy way, compliant with a ketogenic diet. So There's a lot of details on that, Liana, and of course, we'll be happy to see you at TIMC to help you in that way. Uh, Diana is asking, you are truly what you eat, good to. Oh, well, thank you very much, Diana. It was just a comment. And yes, she's right. We are truly what we eat, no question about it. But there's actually a sort of like a last name to this saying that now we say you are what you absorbed from what you ate. Because if all those microbes that we have in our gut, which are only 100 trillion, are not happy, are not healthy, then we're not be absorbing what we're eating, even if it's a healthy stuff. Now, those microbes in our gut love sugar. They get crazy, but they also get sick from too much sugar. So you gotta be careful. And again, I keep saying sugar and sugar and sugar. Now, I don't want you to feel that sugar is completely uneatable or something that we should not eat at all. No, there's ways to eat it, and we need to find our ways to enjoy things, even with sugar, to a certain amount to make sure that we're not uh, causing any damage to our health. And to me, a ketogenic diet is one of the possible ways to go. It's not the only one. If you follow a true ketogenic diet, being that you are a great candidate for it, you hardly use any, you hardly would need any significant amounts of supplements. So, so it can make easier. And I have a nurse practitioner almost, Selena, asking, can you have wine while on the diet? Alcohol is a good question always. And whether we have to be in moderation, you can still drink alcohol. We talk about which one is perhaps the least harmful, and we tend to say 100% agave tequila, but in general, you can drink any alcohol within a certain amounts that we discuss always with our people, our patients. Um, I have Steve here, good old Steve asking, how do you know when your body is in ketosis? That's a good question and it's a smart question. The There's ways to know. We can check ketone bodies in the urine, we can check ketone bodies in saliva, we can check a pH levels in saliva, we can check ketone bodies in blood. We do not have to do that because that has an expense. We seldom, if at all, check them. If the patient is following the instructions, the diet, the way to eat, not to use the word diet, then we know that they're in ketosis. Actually, patients feel different approximately 3 weeks or so after they've been started in the ketogenic diet. That's a better, much cheaper, free way to tell how patients are doing and if they're truly in ketosis or not. Now, there's another question from Gabi. What kind of exams I need? We want to do a CMP, we want to do a CBC. I hope these terms don't throw off anyone. It's just a cell counts and general chemistries. For this kind of diet, we want to check a lipid, which is cholesterol, triglycerides, a lipid profile. We want to check a thyroid profile to make sure that there is no problem with the thyroid, which thyroid is actually involved pretty much everywhere in any system in the body and can be a problem, a hurdle or an obstacle for people to lose weight. So we need to check those. We want to check a urine, want to check the pH on the urine, just in general make sure that there are no infections, crystals, and that the kidney function is doing okay. And I like to use a vitamin D level. Sometimes we can check omegas. Those are not a must. Omega levels are good. And in all these labs that I told you, even without insurance, there's not a lot of money involved. It's actually very cheap. Should you have insurance, then it's even easier. If there's, cheaper for you, or actually zero probably at cost. In some cases where there's a lot of GI symptoms, bloating, gas, abdominal discomfort, on and off diarrhea with constipation, we can use a microbiota testing in the stool. It is very helpful to make sure that there's no underlying problem in the microbiota, meaning these microorganisms in the gut. However, if we don't want to spend more money, the supplements that sometimes we use, but mainly the diet is going to correct the problem. So it's a very easy way to go. There are more questions coming up in here. Um, let's see. Can I do my ketogenic diet for 6 months longer? How long does it take? Or can I do the diet? It's an important question, and as I said earlier, there's a world renowned Tour de France winner, athletes doing ketogenic diet, and they've been doing it for 5, 6, 10 years. I have friends, colleagues of mine, like Dr. Robert Silverman and others, doing ketogenic diet for the longest time. I'm going to give you another piece of information. Maybe we'll wrap up after this by telling you this. You hear that this or that can cause cancer. We always talk about breast cancer. We talk about colon cancer. And, we have cancers, quite a bit of those. Prevalence is quite high and definitely has to do with what we eat. But we don't hear that sugar is one of the main causes of breast cancer or any other cancer. We don't hear that. And, ironically so, some of the cancer societies' main sponsors are food industries or food companies that use a lot of sugar. So you need to know that because cancer cells feed, thrive from sugar. However, they cannot eat, most of them, they cannot eat ketone bodies. Again, ketone bodies are the ones that we generate when we go into a ketogenic diet. So a ketogenic diet, besides being helpful for obesity, diabetes, epilepsy or seizures, it is extremely helpful for cancer. If anyone out there has a very strong family history of cancer or unfortunate to have cancer, ketogenic diet is something that you should consider and talk to your physician, perhaps your nutritionist, about how to do a proper ketogenic diet. It'll be beneficial. Remember, Hippocrates, many, many, many years ago, actually before Christ, said, "Let food be thy medicine." And I think this cannot be more true as we see it every day. And he said it around 2,400 years ago. I'm going to try to see if there are a couple of more questions coming up. And if not, we're going to be wrapping up here. I'm going to tell you this, guys. At Texas Integrative Medicine and Cardiology, we have the knowledge, the expertise, the tools, and the guidance to help you with the ketogenic diet. I have bet my whole career, I have bet all my years of training in cardiology, and recently more so, other 4 fellowships, or I would say additional training, and then a master's in public health on this. I know that I may be a dreamer. I know that dreams come true. When I was a kid, they told me that to be a physician was almost impossible, that only the smartest people in the world could be. And when I said that I wanted to be a cardiologist, even worse so, they said that only few could be cardiologists. When I thought that I could be a cardiologist in the United States, everybody thought that I was crazy, but it was a dream. And dreams come true if you work at it. Now, I have a dream that we can make people healthier in the city of El Paso, perhaps even more so in the United States. I know that we're not going to be able to beat those food industries and the pharma industry. They're extremely powerful. But the only way we can defend ourselves and trying to stay healthy and enjoy life in a better way is by knowing, by educating ourselves. And we're here to try to do that for you. We'll make it easy, put things in your hands. The rest is completely up to you. So with that, I'm going to end and thank you for your attention. We'll see you next live session. We're going to do one more, I don't know, coming up, we'll see. I have a very, very exciting topic. Thank you.